Hello guys, today the topic of discussion is why in old age the people are more prone to hypoxia at the high altitude. And the reason first of all is there is actually less stamina to withstand the hypoxia that occur in the high altitude. First of all, we like to know that what is hypoxia. Hypoxia is actually decrease in the partial pressure of oxygen that usually occur at high altitude. So, what are the pathophysiological changes that occur with increasing age that actually decrease the stamina of the old person to withstand the hypoxemia? So first of all, there is actually decrease the chest wall compliance. So what is the chest wall compliance? Compliance is actually the change in the volume with the change in the pressure. So why there is decrease in the chest wall compliance? First of all, there is actually the calcification of the intercostal and the tendon insertion sites. This causes the decrease in the chest wall compliance. And secondly, there is degeneration of the spinous processes of the vertebrae. So these all decrease the chest wall compliance. That means the chest wall is not able to actually accommodate the lungs, that it will not expand properly. Secondly, in old age there is decreased alveolar elastic recoil. So when there is decreased alveolar elastic recoil, that will cause increased air trapping. So that means that the lung will not actually collapse, and that will cause the trapping of the air inside the lungs. So all these changes actually lead to increase the chances of the patient to die due to hypoxemia. So this causes the increased alveolar arteriolar gradient. So what is meant by alveolar arteriolar gradient? So alveolar arteriolar gradient means that when the air containing the oxygen enter into the lung, it will actually diffuse into the arteriole. So when the air entering into the lung does not properly diffuse into the arteriole, that will cause increase in the alveolar arteriolar gradient. So this is actually the graph that shows the changes with the old age. As you can see that with increasing the age toward the right side, the residual volume is keep on increasing. So as you can see, the residual volume is increasing, as well as the functional residual capacity is also increasing. So we can also see two changes, that is there is decreased efficacy of oxygen exchange. So why there is decreased efficacy of oxygen exchange? So that is due to decrease in the surface area that is in contact with the capillaries. That means there is increase in the dead space. Secondly, there is increased air trapping. So the increased air trapping causes decreased ventilation in the highly perfused alveoli that are at the base of the lungs. So these are some of the changes that occur in the old age that lead to less stamina to withstand the hypoxemia, and mostly cause death of the old people at high altitude.